Good evening, this is Peter Copp and Isabel van Rosmalen from GP+. Obviously this short demonstration video won't really be necessary for existing healthcare providers, but we did agree to make a video just to demonstrate what this kind of testing is all about, and just sacrifice myself as a guinea pig for the simple procedure. Anyway, what we have here is a box of 30 of the BASEC Dutch LFA testing kits. That stands for lateral flow assay. So these are testing kits designed to detect antibodies to SARS-CoV-2 or COVID-19, and that is very different from doing the antigen test, which involves taking a nose and a throat swab, and that is focused really on the diagnosis of that condition in people with symptoms. This, on the other hand, is designed to detect antibodies, which are the body's own response to infection. Now, you'll see that there are two that are looked at, the IgM and the IgG. What usually happens after a viral infection, certainly of this nature, is that the body temporarily produces some IgM antibodies around 10 days after infection, and then they will fairly quickly disappear because they have the role of presenting themselves to the immune system so that memory antibodies can be produced. And these are the so-called IgG antibodies, and they will appear 2 to 3 weeks after an infection. So it's important to stress that this kind of testing really wouldn't be appropriate for someone who's actually unwell. Those individuals are much more suited for antigen testing, i.e. the nose and throat swab. So this is looking for antibodies in people who may have already acquired the infection and are well into recovery or fully recovered, or indeed sometime down the line. So on the front of the box it says that there are 30 test cassettes with 30 droppers. There are no lancets in the box. There are no alcohol pads in the box. That was the case with the pre-pilot study. I suspect a lot of it's just to do with simple logistics, and maybe in the ordinary world that would have all happened. Anyhow, the test cassettes are there, and the buffer solution, there are 2 bottles of buffer solution and a set of instructions. Obviously in a healthcare setting we'll use an alcohol swab, but you can use any kind of alcohol gel, or if that isn't available, just ordinary hand washing with soap and water. Maybe have some tissue nearby, or some cotton wool or toilet tissue. But the essence is that the person doing the test and the person receiving the test should have clean hands, and that there's an appropriate place to dispose of any contaminated paper or cotton wool, and obviously any sharps involved, because we do need a lancet. Now this particular lancet is the one that we have preferred using at GP+. It's called the Unistick 3 Neonatal. These are readily purchasable over the internet. I think we got these, actually we didn't get these from Amazon, but you can. We got these from one of the medical suppliers, but they're not expensive. They're probably the more expensive variety, but you can generally pick up 100 lancets for less than £10 without any difficulty whatsoever. And say it just needs to be carefully thought through in terms of disposing of contaminated lancets if this is not being done in a healthcare setting. So we have our lancet, and one of these is out the box, and I will hand that over to Isabel in a minute, and she will test my blood for the presence of antibodies. So I'll just pop that one down on the table. Tissue paper, we open the box, and the instructions are there. There should be 30 test kits in each box, instructions in various languages, but of course importantly also in English, and they should be read. It does actually say that the first drop of blood should ideally be expelled. I'm not entirely sure why that is necessary, but we will do so. Anyway, I'm not so sure that that is a mandatory step, but we'll pop these instructions aside. And we have here a kit. Now, it's very important for individuals who have acquired these kits just to recognize that storage is very simple. Kits should be stored at between 2 and 30 degrees, so they shouldn't be refrigerated, but equally shouldn't be left in front of a window in a sunny room. In Scotland, it's not that difficult to keep things over 2 degrees C. So just some common sense involved there. And very importantly, the expiry date is not until April 2022. And that's obviously quite generous and relevant, because in certain circumstances, it may be preferential to do periodical testing. It's quite clear that COVID-19 is not just going to be a passing phase, and it's anticipated that it will be part and parcel of our winter and early spring seasonal viruses, a bit like influenza and some other respiratory viruses, which are definitely predicated towards the end of the year and the early months of the following year. So future testing is indeed very likely, and I guess although antibodies are not necessarily absolutely protective against future infection, that's normally what's anticipated, but one would expect if there were IgG antibodies present that the individual would at least be partly protected. And of course, the hope that we all have is that within a reasonable period of time a vaccine will be available, and you would ordinarily expect IgG positive individuals to be pretty reasonably safe until a vaccine appears later this year, but possibly more likely to be early 2021 before it's universally available to everyone in the UK. But there are definitely a proportion of people that can lose their antibodies quite quickly, and there are all sorts of reasons for that. So it's very, very important just to stress again that having a positive test is not a health passport. People should continue to adopt normal infection control practice and to follow normal government and or employer guidelines with regard to appropriate social distancing or whatever guidance is relevant to the nature of their activities. So it's not a health passport, but certainly it's a very useful way of having a look at the infection density here in Scotland, and as a result of collective endeavour, we've got the opportunity to look at around 10,000 people across different sectors of healthcare, nursing, care workers, maybe some teachers, and certainly, hopefully, some representatives of frontline police. So let's get going. I'll pass this kit over to Isabel, who's our technician, and I think she will probably take over some of the narrative and maybe explain her approach to using the test kit. Thank you, Isabel. What do I do next?
What do you do next? If you have a moment, then I will put everything together.
Okay.
So I've got everything in front of me. It makes it easier for me to do the procedure.
Yep.
So.
Should I give my hands a wash?
You should give your hands a wash.
Okay. Okay, there we go. And presumably it's better that we're not outside in the cold. It's easier if the person to be testing...
It's much easier. Besides wind, it's better to do it in a place where you feel comfortable.
Warm and relaxed and comfortable.
Yes, okay. Especially for your hands. It's nice. It's good if your hands are nice and warm. If you had some fluids, because it helps the blood flowing.
Yep. So not to be dehydrated.
Not to be dehydrated.
That's fine.
Sorry.
Okay. So just
So
opening
I'll
up.
open the test.
Now, someone inquired recently if they've opened a test and for some reason didn't go ahead with it, whether the test was ruined. And I think the advice, fairly practical advice, is that it wouldn't be, just to pop it back into the envelope and maybe seal it with a bit of tape, but try and use that test at the next available opportunity. Yeah?
Yes, perfect.
Okay.
I already gave my hands a wash. Normally I use nitrile gloves.
That's nitrile. Yeah.
Nitrile gloves.
Okay.
Just like the tests, I'm from Holland as well, so I'm sorry for my apologies for my mistakes that I make, my language. I've got the lancet over here. I have to screw off the top. So twist it off. And it comes out, I will twist it again. And that way it's open.
So there's a safety blade inside there, which doesn't activate until you squeeze, is that correct?
Yeah, I have to squeeze over here and then it shoots out.
Yep.
It's a very, very tiny needle. It's only 1.8 millimeters.
Okay.
So we'll take your thumb. I'll keep the test ready. I'll also keep the buffer ready.
And we'll try and expel the first drop, as it says in the... I'll just squeeze my thumb. Yep, so first drop away. And then do you want me to squeeze my thumb further?
I will squeeze it for you.
Okay.
That way I can have a better look at where the droplet is going. So you best want to have 2 droplets of blood.
Ah, yeah. That's quite
You
straightforward.
hold this for me.
So presumably then just some direct pressure onto the tiny little wound, and then that seals itself in a few minutes.
Yes, it will seal itself in within a minute.
Now this is the key. If you can explain to everyone, this is a key step.
Yes, over here I've got the buffer.
Mm-hmm.
And I put 2 droplets of the buffer
So very carefully.
into the well.
2. So that's on top of the blood. And I think that helps the blood, if you like, travel along the electrophoresis strip. And I'll bring that kit a bit closer, maybe to the camera. The light's maybe not perfect there. Yeah, that's better. And you can see how there's a pink band running slowly upwards from the blood well at the bottom here, and the pink should make its way north all the way up to the letter C, which is the 3rd letter. Now C stands for control, and that should always show a band of some kind. That's a horizontal band, and if you like, that's a measure that the test was in itself adequate and that there was enough blood and buffer solution in the well to allow a decent test interpretation. So the C band should always appear. Beneath the C there is the IgG, which, as I mentioned earlier, is the memory antibody, and the very bottom band, the bottom of the 3, is the IgM, which is the temporary antibody that can appear even 10 days after an infection. So in the past, I've demonstrated an IgG band, probably from an infection I acquired on a skiing holiday at the beginning of the year. I know that a lot of fuss has been made about the outbreak in a local hotel in Edinburgh as being ground zero. I think that in due course we'll find that infections were in the country well before that date in February, and certainly a lot of the infections identified in Europe were very readily linked with skiing holidays in Italy and in Austria. And in fact, yeah, well, that will all come out in the wash, as they say. But certainly maybe that was ground zero in Edinburgh in terms of multiple contamination. And certainly from my point of view, I was away for 2 weeks and was fully recovered, and I would be extremely confident that I didn't infect anyone in Scotland, but I may have passed it on whilst I was in the hotel in Austria. So Isabel, I'll pass the kit over to you, and if you would perhaps just narrate what you're reading there and bring it up towards the camera, because I can see the result obviously.
Right now I'll bring it up to the camera, and I hope you can see it over here. So we see a clear band at the C, which we suspect in any case because it's a control stripe. And just under the control stripe we see the IgG, it's in small letters. And next to the IgG you see a very clear IgG band. So that would suggest that Peter has antibodies. He has had COVID-19 in the past. The virus is not active anymore.
Yeah, and I think that's interesting because just in the last week or so, one of the reference laboratories in London has made one of the, if you like, more technically stringent laboratory assays available for blood sampling, and that's the so-called Abbott test. Now that's different from the Abbott lateral flow assay test. This is a proper laboratory sample. Anyhow, I suspected that I would lose my antibodies within 3 to 6 months because I have a congenital immunodeficiency. And although I tested IgG positive on this LFA in the past, my test the other week came back as a negative from London. And I'm now very interested to see that I'm still showing an IgG band here. Now, I made an inquiry with the laboratory in London, and they were very forthcoming, and basically, like all tests, they're bedeviled by false negatives. So their false negative rate's about 3%. And there will be indeed a false negative rate with the LFA kits as well. That's an intrinsic problem with antibody testing, and especially with novel viruses like this one, like this RNA virus. So I think the message for me to take home, if I was advising me, is that I probably still have a degree of immunity, which I thought I had lost, and it's probably something that I will check again in a few months' time and see if that still remains on the basis that I do anticipate that it will disappear. But hopefully this video has shown you how easy it is to undertake this testing. I think for those not involved in healthcare, the important thing is that these must be disposed of in an appropriate way. They are an infection control hazard. They can't just be thrown in the bin. They should be put into a proper biological waste unit. That may be a sharps bin or some other receptacle. Now these should be incinerated and dealt with by someone who is approved for that purpose. And if anyone out there who has acquired kits from us has any uncertainty about that, please don't hesitate to contact. If needs be, these kits could even be returned to us for disposal through our approved agencies. So I think it just needs to be thought through carefully, really especially for those not in a healthcare setting. So let's bring this up again to the camera so that you can see, if we bring the light round as well, so that people can see what a positive result looks like. So at the very, very top, you have the C band, which is the control. So that means the test, if you like, has passed the test, and it was an adequate test. The shadow isn't showing that very well, Isabel. I'll just bring the light round, that's better. And then below the C band, you'll see that there's an IgG stripe. So these are horizontal stripes. If you just tip that back that way a bit as well, that's perfect. So there are two bands showing. What I would suggest is if those individuals tested show an IgM band at the bottom, which suggests much more recent infection, it may be prudent to ask for some healthcare advice, the individual is advised to speak to their own GP, or if there are no other options open to you, then you can always email myself or Isabel just to give you some generic advice. So the IgM bands aren't so common, but they may indicate very recent infection, and if the patient still has any symptoms, then probably some kind of clinical evaluation is much more important. It's really the IgG band that we're all looking for, and as I say, there are some limitations in terms of what that means. It's not a health passport, but it is an important finding. If there are any more questions about this testing, please don't hesitate to contact us by the usual means, and we wish everyone well and remind everyone taking part that the anonymous data collection is absolutely essential. This is a key part of all of this, and we'd like to be able to feed that information back into the Scottish COVID Hub. So thank you very much from Peter, and thank you from Isabel. Good evening.